And good afternoon, everyone. Phil Penarski here with CBS 42. Now we're just a few moments away from hearing from Birmingham City School Superintendent Mark Sullivan as he gives an update on the coronavirus pandemic in regards to BCS, and he will continue to discuss the district's plans for vaccinations, COVID-19 education, as well as testing. It appears that Dr. Sullivan is already at the podium speaking over Zoom, and we will take you there live now.
And Ms. Michael on the call, and as other board members come on, we'll stop and recognize them as well. So thank you for joining the call today. And just in a larger sense, thank all of the members of the media as well as our partners who are joining us to talk about the next steps that Birmingham City Schools will take to educate our students and our families about COVID-19 and also provide them with free and convenient vaccinations. And we'll also talk about our plans for providing COVID-19 testing in all of our schools. Our hope is that this comprehensive approach will help make a significant impact on our community. And we know that our community is not just limited to our students and our employees that enter the schools every day. Our community is much larger than that. COVID-19 has a grip on Birmingham and Jefferson County, and we must do more together. Now, the numbers truly tell the story. Last week in Birmingham City Schools, we had almost 200 students to test positive with COVID-19 and 31 employees to test positive. And a number of our students were placed on quarantine or exclusion from class because of close contact exposure. But there's another side to these numbers as well. Of those nearly 200 students, 18 of them were students at George Washington Carver who had to be excluded because they tested positive. But what is important to note is that none of our teachers had to be quarantined or tested positive because we have such a high vaccination rate. We have a similar situation that happened at Huffman High School. We had 5 students to test positive. Again, no teachers tested positive or had to be quarantined. The science tells us that vaccines are safe and effective in battling COVID-19. These numbers provide just further evidence of that. So we must continue to encourage our students and our families to get vaccinated because we know that in-person instruction is the best and most effective way that students can learn. Both the Alabama Department of Education and the U.S. Department of Education are encouraging students to continue in-person learning. So what is next for Birmingham City Schools? I am very pleased and I'm very proud today to collaborate with several entities so that we can provide a comprehensive approach to educate, to motivate, and to vaccinate our scholars and their family members. We are also going to begin testing all of our students who choose to participate for COVID-19 in all of our schools. Our partners in this effort include the Alabama Regional Medical Services, and that's called ARMS, Cahaba Medical Care, MedPlus Partners, the UAB Office of Minority Health, the UAB Public Health Office, the Black Nurses Association of Birmingham, the Greater Birmingham Ministries, the Jefferson County Health Department, and the Housing Authority. Now, we have a lot of things that are on the slate over the next couple of weeks. On Wednesday, we will begin what we're calling COVID conversations for parents. And so we're going to have some of the most trusted local and national medical leaders who will provide information on COVID-19 and answer any questions that parents may have. This broadcast will take place at Parker High School beginning at 1 o'clock on Wednesday, and it's going to be seen through our live stream. And you can go online to our website at www.bhamcityschools.org and click on live stream. You'll be able to see that. But we're also expanding those COVID conversations to our students because we know many of our students have perceptions about vaccines. They have perceptions about COVID-19, and some of those perceptions are being crafted by what they read and see on social media. And some of those things are actually factually not accurate. So this panel of medical professionals will be interviewed by our students at our BCS media studio. And that presentation will be broadcast throughout our school district. On Saturday, August the 28th, we are partnering with the UAB Office of Minority Health for a pop-up clinic at Legion Field from 11 to 1. And it's going to feature the NBA Hall of Famer, Charles Barkley. And Charles Barkley has a group called Get Stuck with Chuck, and he's trying to encourage individuals to get vaccinated. In Birmingham City Schools, we plan to have a vaccination clinic at Parker High School on that same day, but it didn't make sense for us to have two different competing vaccination sites. So we partnered together because we have the same goal. You know, last week, we had to cancel a football game at Winona High School. That was their season opener. And so we know that we have to do more to make vaccines more accessible and available. And we also have to try to get information out there about how safe these vaccines are. Throughout the month of September, we're going to be offering pop-up clinics at our high schools, middle schools, and K through 8 schools. And later on this week, we'll publish a full list of the schools as well as the schedule for those pop-up clinics. This is a critical time across our country. And we in Birmingham City Schools are committed to the safety and the health of our employees and our students and our entire community. We know that getting vaccinated gives us our best shot to ensure that we have a safe return to school and that we keep our schools open. Now, before I talk about our partners, I see that we have another board member who joined us. We have Dr. Douglas Ragland. Dr. Ragland, I believe today is your birthday too, so happy birthday to Dr. Ragland, and thank you for joining us today.
Thank you, sir.
You're welcome. First, we're going to have two speakers. First, the UAB Office of Minority Health, and then we'll have the UAB Office of Public Health. So we'll start with the UAB Office of Minority Health. Is there a representative present?
Yes, I'm here.
So I'm going to turn it over to you to give a few comments and words, and then after we do that, we'll open it up for the press because they may have some questions for us. So Tiffany, I'm going to turn it over to you right now.
Wonderful. Thank you so much for this opportunity, Dr. Sullivan. The UAB Minority Health and Health Disparities Research Center is so delighted to once again partner with Birmingham City Schools. We are hosting an event this Saturday at Legion Field, and we certainly hope that your students and parents and staff and faculty can be able to attend. We are hoping to be able to get as many individuals vaccinated as possible, and we're so excited to also be able to partner with Charles Barkley. He has been a friend to the MHRC for many years and supporting our efforts to be able to address health disparities and underserved communities. And so he is once again excited to be able to partner with us to be able to encourage individuals to come out and get vaccinated. The event will take place this Saturday at Legion Field, August 28th from 11 until 1 p.m. However, if there are individuals who are still in line and want to get vaccinated, we will stay until every individual is vaccinated. There will be food trucks at this event, and so if people desire to get a bite to eat, we are also partnering with V94.9 as well as WVTM. They are providing music. And this, of course, is a socially distanced event. We are encouraging individuals to please wear your mask when you come out and bring individuals with you so that they can get vaccinated. This is a part of a NIH-funded project that the UAB MHRC was awarded back in 2020. It's called the Community Engaged Alliance Against COVID-19 Disparities. And we are working to increase education and awareness surrounding the COVID-19 vaccine, as well as clinical trials. And so we are excited again to be partnering with Birmingham City Schools as you launch your COVID conversations. We have access to resources, videos, fact sheets, and as well as many partners to be able to bring to the table so that we can be a part of the initiative to educate as many individuals as possible, provide fact-based information to address their concerns, their fears, misinformation surrounding the COVID-19 vaccine. Again, thank you so much for this opportunity and partnership.
Well, thank you. And as I mentioned, we want to have a comprehensive approach to addressing the COVID-19 crisis. In addition to vaccinations, we want to ensure that our children, parents who select to have their children tested, we want to do that weekly. And so we have with us Dr. Wingate, and she's going to talk to you a little bit about our testing program. Dr. Wingate?
Thank you, Dr. Sullivan. Myself and Christy Plump, who is an alum of Birmingham City Schools, are here today as part of our COVID testing in Alabama K-12 schools. So I'm really excited to be here with you. Glad that we can build this partnership, but certainly want to underscore the importance of this. And while we're focusing on the importance of testing, because we know that of sentinel testing, so asymptomatic, the tickle of the nose, not the brain swab, is not what we're talking about for those of you who, so not to scare anybody, but we're really just talking about the nose tickle, to have teachers, students voluntarily, along, of course, parents consenting to be a part of this testing program. So our focus is K through 12. We're obviously working with public schools. We're also partnering with some private schools. But I think our focus, in addition to really, as we've seen, even folks who are vaccinated are still, we're still seeing spread of COVID-19 across those groups. And particularly for our children who are under age 12 who can't be vaccinated. So this is really important in multiple ways. So this is voluntary. It is free to Birmingham City Schools. It really helps with us helps to have a better understanding of what's going on at the individual school levels, to make sure that there's nothing that's brewing, if you will. So just keeping an eye on what's going on before the children can be vaccinated if they're not eligible, but also just again to keep an eye on what's going on, because we are seeing children we are seeing a younger group that's getting sicker from COVID right now. So the importance of that in this partnership, I can't say enough in terms of what it is that we're trying to do with you all. So thank you for the opportunity. Christy, is there anything that you would add to this?
No, you covered all of the bases here. We're just happy to be an additional layer of safety through the steps that you've already taken, Dr. Sullivan, to keep our students, teachers, and staff safe. So we're just an additional layer here.
And hearing you talk early on, Dr. Sullivan, about the importance of all of these children, all of the students being in the classroom. And I think that's certainly the goal across the board with all of these strategies. So thank you so much.
Thank you, Dr. Wingate. I saw another board member enter, Mr. Wilson. I thought I saw him.
You did. Good afternoon, Dr. Sullivan. Good afternoon, panel, fellow board members.
And then I see Board President Mrs. Hendricks. She's also joined the call. At this time, Mrs. Stewart, I'm going to turn it over to you to kind of facilitate the question and answer piece of this. And we're all available to answer any questions that you may have. So, Ms. Stewart, I'll turn it over to you.
Yes, members of the media, if you would please, so we can maintain some sense of order, if you could just raise your hand if you have a question, and then we will we'll acknowledge it. Or if you'd prefer, you can also place your questions in the chat and I will read them for you, whatever works best for you. This is strange. I'm not seeing any questions from the media.
Hey there, it's Magdala with Channel 13. I raised my hand, but I don't know if you can see it.
Yes, I just saw it, Magdala. Please go ahead with your question.
Okay. So I just wanted to ask Dr. Sullivan, maybe you can answer this as a two-part question. As we know today, the FDA has given full approval for the Pfizer vaccine, which somewhat, I guess, targets a large amount of the population for Birmingham City Schools. So one, do you think that this is more of a leverage for you all to target those families who are hesitant since the FDA has approved this now? And secondly, your reaction to this approval?
So I know that there have been a lot of individuals who had a lot of hesitancy around the vaccines, and some of the reasons that they gave was because the vaccine had not been given its full approval through the FDA. So hopefully by doing this, it will alleviate a lot of the apprehension that some parents, some students may have. We in the school system are waiting for further guidance from the county and state health office around how we need to address this issue. But I think this is a positive direction, particularly for those people who have that vaccine hesitancy, and they're saying that because it has not been approved or was not approved, then that was their reason for not getting vaccinated. So hopefully this will allow us to vaccinate even more students and more adults in our community.
We have a question. Thank you, Magdalene. We have a question in the chat for Dr. Sullivan. Once a student tests positive, what are the next steps while they are in quarantine? Is virtual still an option so they won't miss lessons?
So once a student tests positive, they will be connected with their child's teacher, just similar to what they would do if a child had the flu. The teacher will provide packets, work for that child. That's not just for the children who test positive, it's also for the children who may be on quarantine because of a close exposure, because we don't want any child to fall behind academically while they're out, either ill or while they're out on quarantine.
With the volunteer testing, will this take place only at specific events around the city, or will this be done at each school?
Dr. Wingate, I'll start this, but if you want to talk a little bit more about what that looks like, our goal is to have the testing at our local schools, all of our school sites, on a weekly basis. So what we would do is those parents would sign permission forms, teams of vendors, and Dr. Wingate can talk a little bit more specifically about that. We'll work to provide that testing for our students. What we want to do is catch all of those individuals who may be asymptomatically spreading COVID. So there may be individuals who may not be showing signs or symptoms, may not have a fever, may not have, runny nose, but they still may be very contagious. And so if we catch that, we can help mitigate the spread. But Dr. Wingate?
Absolutely. No, I'm glad. Thank you, Dr. Sullivan. I think that is key, that this is where we are talking about asymptomatic testing. And of course, when we get into, flu season, et cetera, some of the asymptomatic, that becomes a different issue, as we've heard from school nurses last year. But really on the UAB side, we're going to be working closely with the school district, with the schools, to figure out what works best for them in terms of, how do vendors and testing companies come into their school to make this happen. But we will be constantly in communication with the leadership of the schools, with Dr. Sullivan, with the school district, and make sure that all of that happens in partnership with us. But we will be working with vendors to offer these options, because we recognize that there's only so much that a school nurse can do. And so really trying to engage all of our partnerships to make this happen.
There's a question from Kyra Miles with WBHM Public Radio. Kyra?
Yes, hello. I had a question, well, two questions. First, when will the testing in schools start?
Ms. Wingate, you want to speak to that? I know that we are looking to start at least the process for getting permissions in mid-September, but do you want to talk a little bit more about the actual start date when the nose tickle will happen?
Thank you. Yes, we are working diligently as we speak to get things up and rolling. So I think mid-September is certainly a goal. But these are monies that came from CDC, and then to Alabama Department of Public Health, and then to UAB. So certainly getting through this process, talking with vendors, making sure that we have our scientific advisory committee engaged to where we know that we are engaging in best practice with this. So really, as soon as we can, but mid-September is our goal.
Okay, thank you. And then the second question I had, and Dr. Sullivan, you mentioned earlier that you have a high vaccination rate with your faculty and staff. Would you consider requiring vaccines for faculty and staff in Birmingham City Schools?
So earlier on in the pandemic, we partnered with UAB and we opened up a mass vaccination clinic at Parker High School. At that vaccination clinic, we got nearly 1,300 employees vaccinated. Our position is that we're going to, as far as mandating vaccinations, we're going to wait for guidance around the state and county health offices. Right now, we want to encourage our faculty and staff members to get vaccinated. And through that approach, we have seen a large percentage of our employees become vaccinated. So we are going to continue to wait for guidance from the health, county and state health offices.
All right, thank you.
Ms. Stewart, I think you're on mute. I see you talking, but we...
Lips were moving. That was a trick. there's a follow-up question. Someone wanted you to speak more about a virtual option or any consideration for that.
So we do have a virtual program in the school system right now. We have about 150 students who are participating in that. That's a full-time virtual program. Our goal is next year to have a full-time virtual school. In that program, students who are third grade and up apply for that program and they can attend. As it relates to students who are either quarantined for 10 days or who who may have COVID, right now we are working with their local teacher. There's not a virtual option for that group. That group is working with the teacher to provide work packets similar to what students would do if they had any other ailment. Thank you, Ms. Stewart.
There are other questions coming into the chat that are not specifically related to the testing, vaccination, and motivation. I would encourage those individuals to send your questions to communications@bham.k12.al.us or to send them to me directly, and I will try to get those answered for you. Are there other members of the media with questions at this time?
Hey there, it's Magdala again. Sorry, I just wanted to ask for a follow-up. I know Dr. Sullivan mentioned, I think there were like 1,300 staff, I think he said, that were vaccinated at the Parker site. Can you just say out of how many, like the total number in the district?
We have a little less than 3,000 employees, and those are just the employees that were vaccinated at that one particular site, not including the employees who got vaccinated by their doctors at local pharmacies. We are really proud in Birmingham City Schools that we have such a large percentage of our faculty and staff who did get vaccinated. And it's just not teachers. These are lunchroom workers. These are bus drivers. These are custodians, secretaries. So this is a full gamut of our employees who really saw the value in getting vaccinated and went ahead and did it.
Thank you.
One more. Oh, sorry.
I'm sorry. There's a question, Dr. Sullivan, if you could discuss the effectiveness of masks in schools. I know that the district started with masks. Has this been helpful?
So what I can say is that we have nearly 20,000 employees and, 20,000 students. We have about a little less than 200 students who have tested positive for COVID. I know that in other school districts who have not required masks, now they're moving to masks because they're seeing the spread of COVID-19. So we don't have a measure by which to compare it with, but what I can say is that if we're looking at our numbers and compare to some of the school systems that may not have required a mask, I think our numbers are, whereas we want to have zero spread of COVID-19, we recognize that it's in the community, and oftentimes what we're seeing is students who are coming to school, not getting COVID at school, but either coming to school sick. We're seeing a lot of parents who themselves are sick, and because their students are not symptomatic, they're sending their students to school. And then oftentimes we're seeing those students become positive. We have seen a small number of students who looks like they transmitted COVID within the school. But I think masks, if we look at the entire district as a whole, we're seeing that masks are having an effect on mitigating the spread, not just masks, but the social distancing, the frequent cleaning. And I think that these two other pillars to that, testing and vaccinations, will help ensure that we have school for the rest of the year without having to shut down.
I believe there was someone else who had a question before we started with this one.
Yes, this is Cara Miles from WBHM. As another follow-up, is Birmingham City Schools keeping track of the employees that are vaccinated? Do they have to report whether or not they're vaccinated?
So, in the state of Alabama, we have this vaccine passport law. So we can ask, but employees, just like any other person, is not required to provide that information. And so what we did with UAB, because they were vaccinating employees as well as the community, they were able to identify where you worked as an employee for Birmingham City Schools without identifying you as a name. So that's how we got the numbers from UAB. The other numbers are self-reported around the number of individuals who either got vaccinated by their doctor or vaccinated at the clinic. But with the vaccine passport, individuals are not required in the state of Alabama to provide that information.
Are there any other questions or are any of our partners open to making any comments or anything to contribute to the discussion?
Cheryl, this is a parent, Bettina Bird-Giles. I did not raise my hand, but and I've put something in the chat. Do you mind if I ask?
Yes, go ahead.
For those of us who got on at about 5 after 1, would you explain the program and the partnership? I heard from the UAB person, I caught the tail end of Dr. Sullivan's comments. Do you mind sharing exactly what this program is and what we as parents may be agreeing to in a permission slip or whatever that you described?
So
yes, I can
go ahead, Cheryl.
Go ahead. Okay, so we are working with several entities to educate, vaccinate, and hopefully motivate individuals to be vaccinated for COVID-19. We want to help remove some of the hesitancy. We also want to help mitigate the spread of the virus. And so for that reason, we are partnering with the School of Public Health and looking at testing our students in the school system starting sometime probably later in September. So parents would receive permission requests to allow their students to be tested. We continue to ask that all parents allow their vaccine eligible students to get the vaccination for COVID-19. And so we are working together with the Office of Minority Health, with School of Public Health, with Greater Birmingham Ministries, the City of Birmingham, everyone who is concerned about our community. We're working together to try to get our kids and their families vaccinated so that we can hopefully move to a safer place in our community.
Thank you, Cheryl. We have several of our board members on the call, as well as our the president of the Birmingham City Council. So if any of our board members would like to share anything, I don't see another question in the chat from a member of the media.
Dr. Yeah, I just want to say that it is so exciting to have these partners on board. Birmingham City Schools is doing the best we can, but we know we cannot do this alone. And so having these partners come on board, and there's so many of them, and they're so powerful, and the funds that are brought forward through CDC, through the line. So thank you so much for your partnership. And without you, we couldn't have the impact that we're going to have with this program. So thank you.
Thank you, Ms. Bowen.
Dr. Sullivan?
Oh, Dr. Ragland.
I'd just like to echo Ms. Bowen's sentiments. Thank you so much for the partnership, and we look forward to beating this thing with all of our, I guess, collaboration that we have here. And thanks to UAB and everybody who's involved, all of our stakeholders and so forth. And I'm just very proud to know that we're working towards getting this thing resolved, and hopefully our parents and everybody, students and so forth, will be motivated to take advantage of the vaccine since it's officially approved today. And one more thing, Dr. Sullivan, before I leave, I just want to just say to Bettina Bird-Giles, she's one of my former students at Center Street. So just say hello to her, and just proud of her as well.
Happy birthday, Dr. Ragland.
Thank you, my friend. Thank you.
And we have Ms. Smith and then Ms. Michael.
Yeah, so I'm really echoing what's been said. Thank you to all of our community partners, but then also thank you to our parents for helping us to make sure our students are vaccinated. So if you have some friends of your children that maybe aren't vaccinated, just kind of bring them along too. So, but thank you to Dr. Sullivan and Communications for putting this together. So appreciate it.
Thank you, Ms. Smith. And we have Ms. Michael and then our board president, Ms. Hendricks. Ms. Michael.
All right. Good afternoon, everybody. And Dr. Sullivan, to you and the Cabinet and Communications, thank you for putting this together, and to all of our partners. I think this is definitely a step in the right direction. I'm really excited to see what our students come up with their conversations they're going to have with the experts. I would like to encourage, however, I hope that we will have some communications with our parents and our staff to where they will be able to also participate in asking questions. I think I know there's a high level of anxiety, and even though this is a step in the right direction, I think there's still some concerns and questions that they would like to have answered. So let's be sure and jump on that just as soon as we can. But this has been very informative, and I do hope that many of the parents will get on board with the testing of their students. And I really hope that our employees will all continue to get vaccinated, the ones that have not yet. And be sure and do that. It's vitally important. Our children need to be in the classroom. They need to have the face-to-face instruction, but we also need to be able to ensure people that we are making it as safe as possible. So I do appreciate what y'all have brought to us today. Thank you.
Ms. Hendricks.
Thank you, everyone. I have very little to say. I want to appreciate and thank everyone who's here on this call. I want to thank the board and the Birmingham City Schools executive staff for making this a priority. Thank you, President William Parker, for all that you do with COVID. This is a pandemic. This is something we all have to be concerned with. I appreciate everyone on the board for being here and being involved with you, Dr. Sullivan, to make this happen. But thank you all for all of the work that you do behind the scenes that we don't see. I appreciate you.
Well, Mr. Parker, did you want to say anything before we close out? Mr. Parker, we see your lips moving, but
it was a trick.
So my line.
Can you hear me now? Can you hear me now, Dr. Sullivan?
We can hear you.
Okay, that was a trick, like Ms. Stewart. We were just testing you out. Listen, thank you all, Dr. Sullivan. Thank you, President Hendricks, and all of the school board members and the school board family. On behalf of the City of Birmingham, Mayor Wolfen, the Birmingham City Council, the Birmingham Park Board, it's all of us working together in order to make sure that we finally defeat COVID-19, and whatever we can do to assist in the efforts, we're here ready to serve as true partners, and we just want to applaud everything you're doing, and we're going to be there with you every step of the way because it's about defeating COVID-19, and it's going to take all of us working together. So I'm looking forward to a great week, and we want to encourage everyone to please get vaccinated as quickly as you possibly can. So we're here steady, ready to stand with you all, and just applaud everything that you all have been doing. Even throughout the summer, you all were at all of the high schools, and so we're here to assist in any way we can.
Thank you, sir. And Ms. Stewart, we'll turn it back over to you to close us out.
Thank you, members of the media, board members, members of the community for joining in. Members of the media, if you have follow-up questions, just shoot me a note or send me a text and we will try to respond to you. Thank you so very much for covering this story. As Dr. Sullivan mentioned, we will have a list of schools coming out later this week so that you will know what's coming up in terms of our vaccination efforts. Our COVID conversations will happen on Wednesday and Thursday, and then we'll come back with another round of COVID conversations in September. We are working on having conversations specifically for employees as well. So that's something that is not being overlooked. We're starting at this point, but it is just the beginning. So thank you so very much and have a great day. Goodbye.
And welcome back to CBS 42 Now. That was a live discussion with Birmingham City School officials, including Superintendent Mark Sullivan, as they gave an update in regards to how they will be handling COVID-19 vaccinations, testing, and even education for students and their families, as well as faculty and staff throughout all BCS schools in the coming weeks. I want to quickly direct your attention to the right of your screen. That is the COVID-19 dashboard, courtesy of the Alabama Department of Public Health. You can find it at any time over on our website, cbs42.com. There you can check out all the latest information regarding cases, transmission rate. As you can see, 66 out of the 67 counties in the state of Alabama are considered high rate for transmitting COVID-19 at this time. Very quickly, want to go over just some of the things that Dr. Sullivan, as well as other members of the Board of Education for BCS. Birmingham City Council President William Parker stopped by. Health officials were also there to give their insight in regards to these partnerships with BCS. Dr. Sullivan saying that around 200 students in the BCS school district had tested positive for COVID-19, along with 31 staff members. Lots of these students were or have had to quarantine, but specifically over at George Washington Carver High School, 18 of those students had to be quarantined. But he did say that no teachers had to quarantine due to a very high vaccination rate. He said that he's very proud of the faculty and staff at most BCS locations having a very high vaccination rate, thus leading them not having to quarantine after being exposed to somebody who may have tested positive for COVID-19. One of the other partnerships that is coming to BCS schools very momentarily, according to Dr. Sullivan, is the fact that students will have the opportunity to sign up for testing for COVID-19. They will not be required, but if they would like to, they will be able to sign up and get tested at the school that they are attending, just to kind of keep an eye on that and make sure that everything is good over there. There will also be pop-up vaccination clinics at most K through 8, middle, high schools, all of those schools in the BCS school district. Those will also become available relatively soon, according to Dr. Sullivan just a few moments ago. Again, they were preaching vaccination. Dr. Sullivan, along with the healthcare providers, saying that the high vaccination rate has been very beneficial to the few number of people that have actually had to quarantine and step out of school so far in this young academic year for BCS students. And speaking of vaccinations, of course, the big news coming out of today, the Food and Drug Administration announcing that they have given full approval to the Pfizer vaccine. Health experts, we heard from a couple UAB doctors earlier saying that they expect the Moderna vaccine to get full approval relatively soon as well. But again, Pfizer getting that full approval from the FDA, big step forward in trying to qualm anybody's worries about the efficacy of the vaccine, so going a long way. And speaking of that, we will actually be hearing from Dr. David Kimberlin with UAB and Children's Hospital. He will be speaking in just under 30 minutes at 2 p.m. right here on CBS 42 Now. You can find it over on our website, cbs42.com as well. He will be speaking on what this means as far as the FDA giving full approval to the Pfizer vaccine. Again, that's coming up relatively soon right here. I want to thank you all so much for joining us today on this latest edition of CBS 42 Now. I'm Phil Panarski, and we hope you have a great rest of your day.